Hey everyone, thank you for joining us. Get your questions ready. I am Dr. Deigni. I'm a board certified plastic surgeon and I practice in Houston, Texas. I specialize in body contouring procedures. So that includes the mommy makeover, the breast surgery, so breast lift, breast reduction, breast augmentation, augmentation with implants, augmentation with fat transfer. I do liposuction, lipo 360, arm lifts, bra line lifts, thigh lifts, surgery pretty much for patients who've had massive weight loss and have a lot of loose skin and areas that are really bothering them. So they'd like to get a full body transformation. My signature procedure is the drainless tummy tuck. So whenever I do my body lift procedures, tummy tucks, I don't place drains because I use a technique that allows me not to have to place drains. It makes your recovery a lot smoother and a lot faster. So we're going to be taking questions tonight from everybody. So thank you very much for joining us. I appreciate you always sharing your thoughts and comments. And don't be shy. We will be discussing various topics. So ask away. And also, please go ahead and like Deigni Plastic Surgery. Follow us and go through all the content that I have. I have a lot of videos to educate my patients. Hello, Jackie Marie. Nice to see you. Thank you for joining. I hope all is well in Louisiana. And so post your questions and we'll get right into it and ask and get you in for your consultation. If you're out of state or even just out of Houston, you could still be in Texas. Texas is a pretty large state. But you're not able to actually come into the office for your consultation, then we will start with a virtual consultation and we'll guide you through the process. Hello, Miss Monica. How are you? I'm glad you made it safely back to Florida. Wonderful, wonderful, wonderful. Hello. Thank you, everybody, for joining us. I appreciate it. Go ahead and share the link with friends. Anybody that you know who might be interested in having plastic surgery, and we will be happy to guide them through the process, answer all the questions, and get them booked for their consultations, hopefully in person if they can make it, or we will do it virtually, and then get you in for your surgery. So I always enjoy being able to take care of you guys. And it's always nice to be able to meet you in person as well. So thank you very much, Miss Monica, for coming to see us. We just did her surgery last week, and her follow-up was yesterday. She's back home. So it's fantastic. The process works. I will also be answering questions that I've gathered throughout the week. You guys always post comments and questions on the content that I share. So get ready to enjoy this evening of Q&A with Dr. Deigni. Let's see. All right, who's going to start us off tonight? I see a lot of people joining us. Wonderful. Don't be shy. Ask your questions. I know everybody usually asks, how does the drainless tummy tuck work? Are you at risk of getting fluid collections or infections or problems compared to the traditional way? And my answer is no. You actually decrease your risk of seroma and infections and also other potential surgical complications because I allow you to actually recover a lot faster. So what I do is when I close your belly area, I put a lot of sutures inside to really hold everything in place. That really closes the space where the fluid could collect, and it also distributes the tension around your full belly area so that it allows you to actually start walking upright within the first 2 to 3 days. The majority of my patients are walking upright, and they usually will wean off their pain meds within that time frame as well. All right, Iridian, fire. Thanks for joining us, and thank you for your question. What's the BMI for a plus size tummy tuck? So the max BMI is 35. So let me get you a couple examples of kind of like what the BMI would be depending on your height. So if you're 5 foot tall, your max weight will be 179 pounds. If you're higher than that, then we need to have you lose some weight to be able to get to that BMI of 35. Okay. If you're 5'2", it's 191. If you're 5'4", it's 204 pounds. If you're 5'6", 216. If you're 5'8", 228. If you're 5'10", 240 pounds will be the max weight. All right. Degen paper. Is there anything to help with appetites? As in trying to be able to eat, or most people are trying to slow down their appetite, so we put them on GLP-1 medication. But to help with appetites, I think there are some medications out there. I'd have to look through it. Usually it's the reverse. So that's a very good question. I'd have to look into that. All right, so for these procedures that I perform, so the liposuction, lipo 360, the drainless tummy tuck, and all that, we want your max BMI to be 35. The reason being that, thank you very much, Miss D, for the rose, our first rose of tonight's session. I appreciate it. If you guys find this content valuable and helpful, please do share a rose or a dozen roses or whatever you want to gift, any other gift. It's really not that serious, but I appreciate it. Most of all, I want you guys to really be able to feel comfortable getting prepared for your body contouring procedure. Of course, I would love for you to select us to be your surgery destination for all of you who are out of state, out of town. But even if you don't pick us, at least I hope you'll be well informed so that whoever you choose as a surgeon, you'll be able to ask the right questions. V. Harold, do you perform a tummy tuck and lipo 360 at the same time? Yes, I do. I do that quite often on my patients for their mommy makeovers. So please go ahead and contact us. There is a link on the bottom left of the screen there, and our phone number is 281-724-3138. You're welcome to contact us throughout the week. Our office hours are 9 a.m. to 5 p.m. Monday through Friday. And so definitely come in and see us, okay? All right. And I also perform more than just the tummy tuck and lipo 360. On some patients, I'll combine that with a breast lift and breast augmentation, either with implants or with fat transfer. Some patients, I'll do the tummy tuck, the drainless tummy tuck, lipo 360, and then fat transfer. It could be fat transfer to the butt and hips. It could be fat transfer, like I said, to the breasts. It could be fat transfer to the back of the hands. Some patients want to get some rejuvenation of the hands. It could also be fat transfer to the face to kind of rejuvenate the face. And some women will want to have some fat transfer to the labia as well to rejuvenate the lady parts. So we definitely combine multiple procedures based on your particular mommy makeover. All right, Ms. Monica, thank you. Yes. Dr. Deigni just did my drainless tummy tuck last Wednesday. I was walking the same day. Absolutely. I'm going to post your video of you walking. I just downloaded it, and I'm going to put it together with our pre-op and do a little montage and then share that. And I appreciate you giving consent for us to be able to share that with everybody. V. Hara was asking, what vitamins do you recommend a patient to take before surgery? So most patients don't really need to take any supplements before surgery. The main thing is to make sure that you have a healthy lifestyle, that you're exercising regularly, because that's going to help you be fit. And then also having good protein intake. Most of all is the protein intake that I would like, not necessarily the vitamins. And then if you're iron deficient, then definitely I would like you to be on your iron supplements, because a lot of women have anemia. And so if you have to take some iron supplements, definitely take those. Contact us, Behara. We'll be happy to take care of you, okay? And keep asking your questions. You can call us, contact us anytime, and we will take care of you. Hey, Mocha Vibes. Hello from Katie. You are just down the street from us. Wonderful. I love taking care of all my Houston folks, and of course everybody around the U.S. and wherever else you're tuning in from. We had some people from Jamaica, from Ghana, Africa, Europe. We've got some people, of course, from Canada as well. And of course, people from all over the US coming in and seeing us. So definitely happy to take care of my local folks. So if you haven't contacted us before, please do. Otherwise, continue to follow us and ask your questions. Share the link with your friends. I'll be happy to also answer their questions. And hopefully everybody will get some good value out of this Q&A session. All right. We've got somebody from Atascocita, Humble. Humble. I was just telling my wife the other day that we don't pronounce the H. I don't know why. And my wife is also originally from the Ivory Coast, from Africa. So her first language is also French. I grew up bilingual. She did not. So she's learning English. So pronunciation is definitely very important. So, but thank you very much, Trini Nichols, for tuning in from just down the street as well, more northeast side of Houston. And I'll be happy to take care of you. Put in your information in the bottom left of the screen there, and we'll be happy to take care of you guys, okay? Wonderful. Okay, Mocha Vibes, thank you for your question. Do you do arm contour without skin removal? I do. So in some patients, I'll do liposuction to contour their arm, and I won't have to place a long scar to do the skin removal. Sometimes if you have some skin laxity or some looseness, what we'll do is we'll treat it with the energy-based device to actually give you some skin contraction without having to do the skin excision, because not everybody wants to have that scar. So, so it all depends on what you present with, but absolutely, I'll do some arm contouring without skin removal. Yes, if that is your preferred way, and if it is a reasonable option. PJ, drainless tummy tuck. Should we lose weight first if we have 30 pounds to lose? Yes. So I want you to be within 10 to 15 pounds of your goal weight. The reason being is if we do the tummy tuck and you've got to lose 30 more pounds, most patients will have some changes to the results. However, it also depends on where that excess weight is. Some patients may actually carry everything in their thighs and their belly is loose. They've lost the weight. So in that particular patient, I can move forward with the tummy tuck, because when they lose the weight, it's going to be from the thighs that they're going to lose it. So it really is based on your particular situation and what you present with. And I'm able to discuss that in great detail with you from when we get the consultation, when we do it. And Katie, all right, wonderful. You're just right down the street from us. So definitely come in and see us. Put in your information in the bottom left of the screen. We see patients in the office on Mondays and Thursdays, and then I operate Tuesday, Wednesdays, and Fridays. So definitely please come in and see us. We'll be happy to take care of you, answer your questions, and get you in for your procedures. Patricia Cartwright, can you correct flabby arms, please? Absolutely. Ms. Monica, who just shared a comment with us about 5 minutes ago, she just went back to Florida. She came in last week, had her surgery, and her surgery was a combination of lipo 360, a drainage tummy tuck, liposuction to contour her arms, and then an arm lift with the skin excision to correct the flabby arms. So we combined all of those procedures into one surgery, one day for her, and now she's back home doing extremely well. So really looking forward to it. She's got some swelling, which is normal, some bruising, which is normal, but she looks fantastic. She was walking the first day of surgery. So once she got home, or at the hotel, and then within 4 days, she was already walking upright and on the treadmill, actually. And we're going to be posting a video of that. So definitely, I enjoy doing the arm surgery as well. So please contact us. We'll be happy to have you come in for your consultation, and we will take care of you. Now, if you need the skin excision, we will definitely discuss that as well, and I'll let you know where I put the scars. If you don't need the skin excision, we can do it with some liposuction and energy-based devices for skin tightening. We will also share that with you. Daniel L. Thurman, BBL, can it be taken from the stomach? So yes, so we do the fat harvesting from anywhere on your body where you will give us some fat, depending on how much fat we need to harvest and what type of results you're looking for. Some patients will want to have the hip dips corrected, and they may need a much smaller amount of fat than somebody who wants the full buttock and hip correction. So we're talking about maybe 500 cc's to all the way to maybe 2,000 cc's that we have to harvest. If we have to harvest a big amount of fat, I would get it not only from the belly area, but also from the love handles, the back, the bra line, and sometimes from the arms, sometimes also from the thighs. So it all depends on kind of like where that excess fat is located, what our goals are for your particular surgery. So everybody is different. And that's why when you guys ask for specific prices and things like that, we can't really give you a specific price because it really depends on the actual person. We can definitely give you some estimates. We're happy to do that. Contact my office. My patient coordinator, Linda, will be able to get a little bit more information to understand kind of like what you're looking for, and then we can guide you. And then when you come in for your consultation and I examine you, then I'll be able to know more specifically what your specific treatment will be. And then we can give you a quote that you will be able to start budgeting for. It's going to be inclusive of the surgeon's price, the facility fee, and the anesthesia fees. All right, Patricia Cartwright, you're in Texas. Wonderful. If you're not in Houston or able to come to Houston for your consultation, we will start with a virtual consultation. I've had plenty of patients who've gone through that process and have done extremely well. So, okay, very good. Let's see here. Georgia Peach in Texas. All right. I also spent some time in Atlanta. That was actually my first home here in the US. 12 years strong, and now I'm in Houston. I'm so glad you're in Houston. If insurance covers diastasis repair, can we tack on the tummy? Okay, so great question. I don't take insurance, so my patients pay out of pocket. For that, typically, we have you discuss with your insurance to see if they can actually cover that cost and reimburse you directly. So all of my patients who have insurance who want to go that route, we'll give them the CPT codes, diagnosis codes, and all the information that they need that they can talk to insurance and have the insurance reimburse them a part of that. Thank you very much for joining us. I really appreciate it. Please put in your questions in the chat and I will answer them as well. Okay, very good. Great questions, everybody. That's fair. Cheryl Saunders, 483. Thank you. Hello, Kitty. Okay, so I have lupus. Can I still get body contouring? Yes, I have operated on patients who have lupus. The main thing is we need to know how active your lupus is, if you're having any active flares or not, where you're being affected by your lupus. And I've done body contouring procedures on my patients. I've done tummy tucks. I've done a combination of mommy makos with liposuction, tummy tucks, breast work, breast augmentation, breast lift. So it all depends on how severe your lupus is, where it is affecting you, and whether or not it is under control. So we definitely have to get that under control. But yes, short answer to your question is we can move forward. We'll just have to make sure that your rheumatologist is on board and that we have good control of your lupus. Pamela D, 355. What about loose chin skin due to weight loss? Yes, I also do neck lifts and fat and well, if you have fat to be removed, I'll do some fat removal, so like liposuction. But if it's strictly loose skin, then I'll do a neck lift, and we may actually need to do a facelift as well, because a lot of patients will complain of some sagging jowls, and then all of that loose skin that comes down here. So yes, definitely, we'll be able to take care of you as well. So contact us, put in your information in the bottom left of the screen there, and we will be happy to get you on the schedule so we can see you. All right, let's see here. Tomo, hi, do you do the vector technique oblique to oblique plication in your tummy tuck. Okay, so I don't. And I do the repair of the diastasis. But I have seen patients, not patients, I've seen other plastic surgeons do it. I just came back from the aesthetic meet where some plastic surgeons would do it. They don't do it on all patients. It's whether or not there is some laxity or some looseness. So if it's indicated, we can do it. Otherwise, I don't do the oblique to oblique plication. I do most of the plication in the midline for the separation of the muscles in the rectus abdominal muscles. Great questions. Loving it, loving it. Okay, great. So Cheryl Saunders 483 is asking, what is the downtime for radiculoplasty? Most of my patients, so for the scar that goes from the elbow into the armpit, most patients will tell me that at 3 weeks is when they feel like their arms are not heavy and they feel more like their normal arms. However, being able to go back to work, I would say 1 week is plenty to be able to recover. You will have the ACE wraps or some type of compression sleeve on your arms to be able to recover. And you will wear that compression for probably anywhere between a month to 2 months, depending on how you swell. But as far as going back to, thank you very much, MZ59, for joining us. Ask your questions, okay? So as far as like going back to work for a desk job, you'll be able to go back to work within a week. Not a problem. Let's see here. Of course, everybody heals differently. That's just in general. You can definitely take 1 week off, and in general, you should be able to go back. Laughing like a tummy tuck, yes. Vanny is asking, hi, do you have a BMI limit? Yes, I do. 35 is the max BMI for the majority of these procedures. Of course, it's on a case-by-case basis, but that's just a blank statement. 35 is the max BMI. So let me give you some examples of what that means. If you're 5, I think somebody had asked about being 6'2". 6'2", I guess your max weight will be 250 pounds. So if you're higher than that, we need you to lose the weight so that you can get into that safer zone of BMI. But say, for example, you're 5 foot tall, max weight will be 179. If you're 5'4", max weight will be 204. If you're 5'8", it'll be 228 pounds. And I do have I have a couple of videos talking about BMI and BMI calculators on my TikTok video. So scroll through the content. There's a lot of educational videos, a lot of tips. And I do this pretty much for your benefit, for you guys to get as much education, as much information as you can. For those of you on YouTube and Instagram, definitely go to my TikTok channel as well, Deigni Plastic Surgery, same handle, and you'll be able to actually take advantage of all those educational videos as well. PJ from Katie, right? They might have a drainless tummy attack that I'm looking into. Okay, property tummy tuck, but also know of 2 hernias. If you have a hernia, okay, so if you have like large ventral hernias, typically we'll have you get those repaired before you come in for your drainless tummy tuck or some type of liposuction and things like that. If I discover hernias while I'm doing your tummy tuck, in other words, we couldn't feel them before and you weren't aware that you had hernias, I will fix them during the tummy tuck procedure as well. Staying Happy 3, I love that. Hello from Montana. All right, Montana. That's a state I haven't been to. I would love to go and visit. Thank you for tuning in and thank you for joining us. Ask your questions. I'll be happy to answer them, okay? Don't forget to put in your information in the bottom left of the screen there so we can reach out to you. I'll get you on the schedule for your virtual appointment and also get you in for surgery. Like Deigni Plastic Surgery, this is a website. You can go and check it out. Phone number, and also share the link with anybody that you think will be able to enjoy these sessions. Georgia Peach in Texas, do you repair umbilical hernia? Yes, I do. So if I see an umbilical hernia while I'm doing the drainless tummy tuck, I will go ahead and repair that as well. Yes. Oh, okay. Sorry, voice typing. No worries. I have 2 hernias, but was looking into a drainless tummy tuck. Okay, yes. So depending on where those hernias are, how big they are, um, uh, we may be able to move forward with the drainless tummy tuck, and I'll repair your hernias while I'm doing your drainless tummy tuck. So contact us, and we'll be happy to have you come in to get your consultation. I will examine you, and we will discuss your goals for your transformation. All right, let's see here. I saw somebody ask something about, okay, so pricing for chin lipo. For pricing for any of these procedures, please go ahead and contact my office. My patient coordinator, Linda, has the estimates for these pricing procedures. Of course, without seeing you, we can't tell you exactly how much your specific procedure is going to be, but we can always give you estimates and a range. So please contact my office, okay? Put in your information at the bottom of the screen. We'll contact you as well, or just call our office, 281-724-3138, 9 to 5 Central Standard Time, Houston time, Monday through Friday. All right, let's see here. Staying Happy 3. Okay, from Montana. Do you do the fleur-de-lis? Yes, I do. Also, look through my content. You'll see plenty, or at least a few of the before and after patients' testimonials, before and after pictures as well of their surgeries, and you'll see the beautiful results from the fleur-de-lis tummy tuck. And I do this drainless. I do all of these procedures: the thigh lift, the arm lift, body lift, which is a combination of the drainless tummy tuck with the hip lift and butt lift. I do all of that drainless. I do the fleur-de-lis as well, drainless. It makes your recovery much easier and much faster than the traditional technique when you are getting drains. What about 5'2"? So if you're 5'2", max weight is 191 pounds. Okay, so Marty is saying, doctor, please fix me with the payment plan or affiliate promoter. So definitely, payment plans, you can definitely do payment plans. We also have financing. We have 4 financing options: Care Credit, Patient Fi, Cherry Financing, and Alpheon Credit. Payment plans, I have some patients who come in and they'll do a payment plan and make a deposit every 2 weeks. The main thing is you have to pay fully before we move forward with surgery. Usually everything has to be paid fully 2 to 3 weeks before surgery. So you can take 6 months to make your payments. And then at the end of that 6 months, you can have your surgery. So what we'll do is you come in for your consultation, you get the quote, and then you set up your payment plan and your surgery date. And then during that time, as your budget allows, you make your payments. Definitely, I've done that with my patients before who've needed it. So contact us. We'll be happy to take care of you. Hello from Mississippi. All right, baby Todd. Cool. I've been to Mississippi. I actually have a couple friends there. So thank you for joining in. Ask your questions. And also let us know where everybody is from, okay? Like I said, we've got some people from all over the U.S. We get people flying in, driving in from multiple different states. And it's always wonderful to be able to take care of you. PJ, the doctor told me just to do ab exercises and didn't recommend surgery to repair the hernia. Oh, okay. So very interesting. So I don't know where those hernias are, but regardless, if I do your drainless tummy tuck and I actually do see those hernias, I'll go ahead and fix them, because we don't want the weakness to get bigger, that hernia to get bigger, and contents from your bowels to start pressing and going outside of that defect, that hole, and give you some problems. So if we do the drainless tummy tuck while I'm actually operating, I can visualize your whole belly area where I'm operating. And if I see weakness in your belly area, or if I actually see a hernia, I'll go ahead and repair it or reinforce it to give you better results. Perfect. Great questions. I love it. This is a nice session, different from some of the others as well. So it's always good to have some questions that just come out of left field and very different problems that people ask us. That's wonderful. Letty Rocha 237. Will you do this on people that have diabetes? Yes, I've operated on patients who have diabetes, type 2 diabetes. We need to get your hemoglobin A1C to 7 or less. Once we get you in that safe zone, we can move forward with surgery. I've had patients who've come in, their hemoglobin A1C was a 9, one was like an 11, other one was like maybe a 13, I don't remember exactly. But in other words, it was pretty high. Those are not safe. We cannot move forward with surgery because you won't be able to heal, and it's going to be a miserable recovery. So we make sure that you get the appropriate treatments, get the right medical team to take care of you, either an endocrinologist or primary care doctor. They put you on the appropriate medications, get you down to that hemoglobin A1C of 7 or less, and then we move forward with surgery. And if you look through my TikTok content, you'll see plenty of my patients that I've operated on who have had those types of medical problems like diabetes, type 2 diabetes, high blood pressure, anemia, lupus, arthritis, thyroid problems, you name it. Marty, do you fix C-section scars while doing a lift? I do, absolutely. So if you look at the videos I've posted just recently, I had a patient that had a hysterectomy scar, C-section scar. I had another one who had a C-section scar that went vertical. And I take care of them. I remove that. I remove as much of the scar as possible to give you a nice flat belly and give you a low bikini scar so that when you're wearing underwear or a swimsuit, your scar is not visible. So definitely contact us, Marty. Put in your information on the bottom left of the screen there. We will take care of you. What about fibroids? So Kimmy 713. It depends on how bothersome your fibroids are. If you're having a lot of abdominal protrusion because of your fibroids, then I would recommend that you see your gynecologist so that they can actually remove those fibroids. If they say there's no indication really for your fibroids to come out, we can do your drainage tummy tuck. It's not a problem. So definitely consult with your gynecologist, of course. You skipped all of my questions. Marty, I just answered your question. If I missed any other questions, please go ahead and repost them, okay? Sometimes TikTok doesn't show me all the questions. So, but I know I just answered your question. So if there's another question that I missed, please go ahead and repost. Okay, perfect. Maria, excellent. Good. You'll call in the morning. We'll be happy to take care of you. Thank you for joining us and thank you for participating. Let's see here. Okay, and please go ahead and share the live link with friends who might be wanting to have surgery. Hey, Laura, how are you doing? Good. Hello, Dr. D. I'm doing great. This is one of my patients. Also doing extremely well. She's been following me for over a year now on TikTok, has been asking plenty of questions, and she just had her surgery about almost 2 weeks ago. So we're very excited. She's doing great. She's doing very well. She's very, very pleased with the results. It is life-changing, and I'm just very excited. So looking forward to taking care of you again with any other procedures that you would like to have done. Let's see here. Okay, so great question. Let me answer this question by Kimmy 713 because it makes a lot of sense to ask this question. Is there a way to set up fibroid removal with a tummy tuck? I recommend against that because for the fibroid removal, you have to go inside the belly area. So just very quickly, you've got on human anatomy, you've got the skin, you've got the fat layer, you've got the muscle layer, and then beneath the muscles, now you get into the abdominal cavity. In the abdominal cavity is where you got the bowels, all your organs, your liver, kidneys. Those are much further down. But you've got your bladder, your uterus, your ovaries, and that's where the fibroids will reside in the uterus. Now, to get there, they have to actually go through. And sometimes when you go through that, it changes the dynamics of the surgery to where it's no longer a clean surgery or sterile surgery. When we do the tummy tuck, we don't go inside the belly cavity. We stay superficial, which means on the top side. So skin, fat, and then we see the muscle. We don't even go below the muscle before we get into the butt and the belly where the gynecologist would be. So my recommendation would be get your fibroid surgery done first. And most of the time, they'll probably be able to do it laparoscopically, with very small incisions, recover from that, and then come and get your tummy tuck done. That's what I would recommend. It's kind of like people asking about getting a hysterectomy and a tummy tuck at the same time. I wouldn't recommend it. I know people do it, but I wouldn't recommend it. Okay, GHMGGM is asking, do y'all take insurance? No, we don't. All of these procedures that I do are not covered by insurance. Our patients pay out of pocket, and we have payment plans, financing options available, and we are happy to guide you through it and get you on the books for your procedure. V. Haro, I will be calling tomorrow to schedule something, so remember me. Wonderful. I always ask my patients what their handle is. So V. Haro, definitely mention that in our consultation, okay? I'm always happy to meet you guys in person. All right, let's see here. Let me get to other questions. I may have missed somebody. Okay, very good, very good. Marty is saying, doctor, you look genuinely care about people. I really hope to meet you. Wonderful, thank you. Yes, I do care about my patients, definitely. Very quick. Hey, Jana, to you and Tiny TY2781. Thank you for joining us. This is my second career. Very short, brief. I am a rocket scientist. I'm an aerospace engineer. That's why I was in Atlanta. I went to Georgia Tech, but also worked at Johnson Space Center here in Houston, Texas. And then I switched into medicine because I wanted to actually take care of people on a personal level. So my goal and my desire is to be able to help you guys genuinely. And so that's why I'm in this profession. And whenever somebody asks me, do you tell me, hey, they want to go into medicine, I ask them, do you really like taking care of people? Because if your heart is not in it, it is way too big of a sacrifice to just be, going through the motions and trying to do that. You really have to be fully engaged in wanting to help people. Of course, there's going to be some people that really, get on your nerves, and you don't necessarily want to see. Well, that's just human nature. That's in every business. But generally, absolutely love taking care of people. And that's why I'm doing these live sessions, is to be able to educate you guys, help you guys sort out through the misinformation that is out there. I would love for you to pick me as your surgeon, but if you don't, that's fine. But I just want to make sure that you have the information to ask whoever is going to be your surgeon the right questions, so that you're safe. I had mesh removal and I need a tummy tuck due to this severe surgery. They removed my mesh mess. Okay, so it sounds like you've had some extensive work done in your abdomen and you would like to get some improvement in how it looks. So definitely contact us. Put in your information on the bottom left of the screen. There should be a form there. So contact us and we'll be happy to get you in for your consultation. Diana 359, how much is a tummy tuck? Great. So on average, it's anywhere between 11,500 to 13,000 or 14,000, depending on what exactly we need to do. So for example, for that patient that just asked a question, she's had extensive abdominal surgery. I already know that it's going to be a lot of scar tissue. That takes a lot more effort, a lot more work. It's very tedious. To be safe, to not injure anything, to remove scar tissue, that's much longer, much more involved. That's going to be on the higher end of the tummy tuck than somebody who's never had any abdominal surgery and doesn't have any hernias and things like that. So it all depends on what you've had done, how much work it's going to be, because it also ties up with how much time it's going to take to do the surgery, because you have to factor in anesthesia time and facility time, and they factor by the length of the surgery. So, but great question. So definitely put in your information, please, everybody, and we'll be happy to take care of you guys. Arise Creations 93 is asking, what is the BMI? Okay, max BMI is 35. So, for example, if you're 5'4", your maximum weight would be 204 pounds. If you're higher than that, weight-wise, you need to lose the weight and come down to a safer zone. Baptiste 1231. How long after a tummy tuck can someone get liposuction? So typically, I'll tell my patients, you want to wait 6 to 9 months, because we need to make sure that things are healing well. So probably more towards the 9-month mark, but you can come in for your consultation at 6 months, because our quotes are good for 6 months. So if you come in 6 months after your surgery, give yourself another 3 months or so to heal, we'll be able to get you on the books and reserve your procedure. So contact us, come and see us, and we'll be happy to take care of you. And these are all general answers, because, of course, everything depends on the particular situation, the particular person, their anatomy, their past medical history, surgical history, and things like that, that we'll be able to determine. Saying Happy 3. I'm looking for a doctor who has OCD, detailed, and likes it perfectly done. Straight lines. Wonderful. Well, being a rocket scientist, we definitely pay attention to a lot of details and being meticulous, giving you the smallest thin scars that we can possibly give you. One of my patients, hey, Jess in Texas, thank you. Wonderful, wonderful. Let me get to you right now. One of my patients was telling us, and it was the first time I actually had anybody say that she could hide her scar with just a shoestring. A very nice thin scar. And I will be posting some of these videos as well. I have some other patients, and when you come in, we give you photo panties. It's like a bikini, and it has very, very thin lines, and they actually cover the scar, which is fantastic. So looking forward to seeing you from Montana. Please go ahead and contact us. We'll be happy to schedule your consultation virtually, and we'll start the process like that. So let me answer your question there, Jess in Texas. Thank you so much for joining us. Hey, doctor, I'm doing a live on multiple platforms here, so definitely happy to be able to answer all these questions. Hey, doctor, I am ready for my mini arm lift. What is the price range and the recovery time? Perfect. So we need to see you. Contact my office. The phone number is 281-724-3138. Usually the mini arm lift, the incision is hidden in the armpit. I need to see what your arm looks like, if we're going to be doing 360 lipo of your arms or just a specific area. So the recovery will also depend on that. But usually for the mini arm lift, your recovery is much faster than if I do the full scar that goes from the elbow to the armpit. So your recovery will probably be 1 to 2 weeks. It's a lot faster than the full recovery from the full brachioplasty. Thank you. Looking forward to meeting you, okay? And actually, definitely call my office and we'll get you scheduled, okay? Perfect. Hey, how's it going, Dr. Chap? Thank you for joining us. All right, let's get back to these questions here. End tabs. I've been approved for medically necessary skin removal. I'm worried about those results. Make sure that whoever you've been approved to go see is board certified. A plastic surgeon, I highly recommend that you see a plastic surgeon, not just a cosmetic surgeon, somebody who's done like a 6-month course or a 3-week course and then calls themselves cosmetic surgeons. Go see a plastic surgeon. So this is public knowledge. Go to abplasticsurgery.org. It's public information. It's a website by the American Board of Plastic Surgeons of Plastic Surgery. So you click on it. It says, is my surgeon board certified? Put in the name of the surgeon that you're wanting to go and see. And if it doesn't come up with the date of certification, expiration of the certification, and the name of that surgeon, then they're not a board certified plastic surgeon. So definitely do your research, be proactive, and come and see us. We don't take insurance, but if they've approved you, hopefully they can reimburse you directly. Okay. You need more than just the stomach and skin removal. Okay. Definitely. We'll be happy to take care of you. Monique Dogan is saying, I lost a lot of weight and have extra skin on my thighs and behind and rest. I need a full body lift. Okay. Well, congratulations on your weight loss. We'll be happy to take care of you. I love taking care of my patients who've lost excessive amounts of weight and doing superb body transformations for them. These are life-changing procedures. And typically what we do is we will stage the procedures because it's way too much surgery to be doing it all at once for the body. Okay, let's see here. Arise Creations 93 is asking, what's the BMI? Max BMI is 35. So again, if you're 5'4", your max weight will be 204 pounds. If you weigh more than that and you're 5'4", you'll definitely have to do some weight so we can move forward with surgery. You're very welcome. You're very welcome, Marty. I'm glad I was able to answer all your questions. Like I said, sometimes it's a little difficult to see the questions with TikTok here, and then sometimes they actually skip questions there too. So perfect. I'm glad I was able to answer your questions. I'll be happy to take care of you. Definitely come in for your consultation, or we can start virtually if you're not in the Houston area. Baby 15, what's the starting price on the tummy tuck? So for the drainless tummy tuck, it will be anywhere between, it's usually on average $14,000. It could be anywhere between $11,500 to $15,000, depending on what needs to be done specifically for the patient and what types of surgeries they've had. Because if there's a lot of scarring, a lot of, if there's hernias that we need to repair, we have to factor in the amount of time it's going to take to do those repairs and fix things and elevate the tissues with the scar tissue, because facility and anesthesia charge by the minute or by the hour. So we definitely have to factor that in. That's where the variability comes for our patients. Cookie, please address visceral fat. Sure, my A1C is 6. I work out 4 to 5 times a week intensely. Treatments, let's see. Oh, RX. Let me see if I can. 140 pounds, age 59. Fantastic. Okay, so with a hemoglobin A1C of 6, you will definitely qualify in my hands to be able to move forward with surgery. And age is not a limiting factor at all. It's your overall health. Visceral fat is fat that is inside your body. So there are 2 types of fat that we talk about. Subcutaneous fat, which means fat below the skin in general. So that's everywhere here. Fat below the skin that you can feel. And then there's fat that is actually inside your body around your organs. So there's fat around the heart, there's fat around the liver, there's fat around your belly, your intestines. There's fat around your kidneys, fat around all of those organs. That's visceral fat. And that produces some bulging on your belly. So if you see patients who have kind of like a barrel type shape with their belly, but then you feel their skin, the fat that they have right underneath the skin is actually minimal. All of that pressure is coming from inside, deep inside. The only way to actually be able to affect that visceral fat is by weight loss. So you have to lose the weight. So it sounds like you're very active. And so you may have a very low amount of visceral fat. It all depends. So, but keep definitely exercising, keep your healthy lifestyle, and keep your hemoglobin A1C 6 or lower. Perfect. Arise Creations 93. I think we answered that question. Do you take insurance? We do not take insurance. The majority of the procedures I do are not covered by insurance. Our patients pay out of pocket. We have some financing options. We have payment plans. We have options that you can take advantage of. Kimmy713, you're very welcome. I'm glad I could answer your questions and give you some value tonight. All right. So S. Michelle says she's 5'5", 194. So I think everybody has heard me. If you're 5'4", it's 204. If you're 5'5", it's 210. So you would qualify for these body contouring procedures in my hands, and I will be happy to take care of you. So definitely put in your information in the bottom left of the screen there. There should be a form. And then, guys, don't forget to send some roses, gifts. We appreciate it. I think we're at 13 out of 50. Our goal is 50. If we can achieve that goal, that would be great. I appreciate it. All right, let's see here. And share the link with your friends, especially if you know that they will be happy to get some information, free information, valuable information. I'm a board-certified plastic surgeon, and I'm happy to answer your questions. So, okay, so as Michelle, I just answered your question, are you too big for surgery? Nope. In my hands, with a BMI that is less than 35, we can move forward with surgery. So definitely come in and see us. We will be happy to take care of you. Do you do assisted lipo? I had lipo and I think I need assisted lipo. Yes, I do. I do power assisted lipo. That's the type of liposuction I do. Rachel Crofton. So come in and see us. I also do revision surgery on patients. I've had plenty of patients come in who've had surgeries elsewhere and coming in for some revision surgery. So definitely give us a call or put in your information in the bottom left of the screen there, and we will be happy to take care of you. Thank you very much, Maria Martinez, 7512, for joining us. Don't be shy. Ask your questions. How much for Lipo 360 and a tummy tuck? Definitely contact us, Blanca Vargas 0508, and we will be able to give you the estimates. Most of these body contouring procedures will range anywhere between $15,000 to $20,000+, depending on everything that you put in. If you want a full mommy makeover with, fat transfer, BBL, lipo 360, tummy tuck, breast, all that stuff, it could be anywhere between $20,000 to $30,000. Everybody's quote will be different, but you can range from, like I said, $15,000 to $25,000 or more, depending on everything that you put in. We try to minimize the surgeries to 6 hours of surgery. That anything higher than that increases the risk of surgical complications. If we do too many areas of surgery at once, it is really demanding for the body to heal. So we definitely want to make sure that you get through these procedures safely, and then we'll be able to take care of that. Okay, so yes, great question in tabs. Our payment plans all through third-party financing. Yes, so we do third-party financing, 4 of them: Patient Fi, Alpheon, Care Credit, and Cherry Financing. We also have some patients who will come in and pay in installments with a cashier's check or a money order, or with cash. So the main thing is your payment has to be received in full 3 weeks before surgery. Very nice. Great questions. Great questions. Thank you very much, Jackie Marie. I appreciate your support and encouragements. Yes. She said you found the right one. Yes, yes. Staying Happy 3 will be happy to take care of you and be meticulous with your results, with your process and your healing. Like I said, that's why I do the drainless tummy tuck. Thank you, Nicole, for the roses. I appreciate that. All right. She brought us to 50%. Yay. Wonderful. We're almost done with the goal there. All right, let's see here. What's the starting amount for Lipo 360? So for these pricing, please come and see us or call us, and we'll be able to give you estimates. Of course, these particular price will vary based on the person and your particular situation, medical health, surgical history, and things like that. So Tiffany Lynette, please go ahead and contact us. Put in your information in the bottom of the screen. We will reach out to you and get more information so we have a better idea and give you the estimates for that, okay? And all of our quotes and estimates will include anesthesia fees, surgeon's fees, and facility fees. Caramel Diva 1913. Do you do arm lipo? Yes, I do. Awake, it depends. It depends on how much we need to remove because we want to make sure that you're comfortable. And that's the main thing when we do liposuction. If we feel like it's not going to be feasible for you to be comfortable to do the amount of lipo that we need to do, then I'll put you to sleep. All right. You're very welcome, Monique Dogan. Looking forward to taking care of you. TT is saying, can I get... I think we need the less. Yes, you can get these surgeries, absolutely, but we need to make sure that you're healthy enough. Yes, it is life-changing. I'm so happy I found you. Thank you very much, Dr. Marie. I appreciate it. Looking forward to taking care of you again in the future for your other procedures. Okay, so 3 triplets 07 had the gastric sleeve, and we'll need the next part of that question. Okay, perfect. Yes. I know I don't want to deal with drains at all. End taps. Well, absolutely. So I do the drainless technique. So definitely come and see us. We will be happy to take care of you. It's a game changer. Makes your recovery a lot easier. Hello, Rosa Rocha from Brazil. I hope you're doing well. Thank you very much for tuning in. God bless you and hi to the family, okay? So if you don't want drains, definitely come and see us. I do all my surgeries drainless. Except for the facelift or neck lift. We do have to put some drains there, but those are really small and will stay in for anywhere between 5 to 7 days and then remove them. But the body, no drains. Okay, so you have a hernia and you would like to have surgery. So if your hernia is big and you already know that you have one, what I always recommend my patients is get that repaired. Usually the general surgeons will repair those hernias and your insurance will cover that. So get that repaired first and then come and see me and I'll be happy to do your tummy tuck. 3 triplets 07 had triplets. Oh, congratulations. And had the gastric label. Will you be able to get my muscles tightened really well? Back. Yes. So definitely when I do your tummy tuck, I'll be able to actually bring those muscles back in to give you a more physiologically normal alignment of those muscles and hopefully get you a much tighter and more functional belly. Absolutely. So come in and contact us and we'll be happy to take care of you. Yeah. Excellent. So, okay, great. If I miss your questions tonight, please go ahead and contact us or put a comment in any of my videos on TikTok and I will be sure to respond. How long after a C-section can you get plastic surgery? What procedures are in the mommy makeover? Okay, very good. So after a C-section, I would want you to wait about 9 months, 9 months to a year to be able to heal. But yeah, usually around 9 months, you should be good enough to be able to come in for your C-section, for your tummy tuck or for your mommy makeover. What is included? It all depends on the particular patient. It usually is a combination of a drainage tummy tuck and some liposuction. So usually it will be lipo 360. So liposuction of the belly, the love handles, the back, the bra line, and then plus or minus some type of breast surgery. So it could be a breast augmentation, it could be a breast lift, it could be a breast reduction, it could be a combination of a breast lift with augmentation, either with implants or fat transfer. So it depends on what exactly your body needs, what you want to look like, what your aesthetic goals are. For pricing, please go ahead and contact us and we'll be happy to give you some estimates once we get a little bit more information so we know what what to expect. And when you come in for your consultation, either virtually or hey, thank you, Brandy Lou, for joining us. I hope you're doing well. God bless you. So TT 45 54 50. What I was saying, I think it was saying it all depends on what you include in your mommy makeover, and we'll give you your specific pricing for your mommy makeover in the quotes. All right, so I have a hernia. Would I be able to get a mini tummy tuck? It depends on where your hernia is, how big it is, what your symptoms are, and what your belly presents with. You may not be a candidate for a mini tummy tuck. A mini tummy tuck is really limited to just a very small, particular type of patient population. There's not that many patients that actually qualify for just a mini tummy tuck. They will actually benefit from getting the full tummy tuck. So it all depends. Come in and see us. We'll be happy to see you. If you have a large hernia and it's bothering you, like I said, I tell my patients is get it fixed by general surgery. They typically will fix that, and your insurance should cover that. So we will be happy to take care of you once you get that fixed, and we'll do your tummy tuck, either mini or full. Nazama Ashby. How much for the body contouring of the arms? Contact us for pricing. It all depends on what you exactly needs to be done. Contouring of the arms could be liposuction. It could be a combination of liposuction and skin tightening or skin excision. So it all depends on what exactly needs to be done so we can give you a more accurate price. We will give you a quote once we've actually had the consultation with you. I know what we're going to be doing. If it's virtual, I'll be able to see the pictures. You'll show me what your body looks like, what you're wanting to have done, and then we can discuss the appropriate treatment plan for you and then give you the quote. Okay, yes, I think I have said for gastric sleeve. Okay, yes, I think there's a typo there. So getting a tummy tuck with muscle repair will fix the stomach tight. Yes, it will. Definitely. So you have that separation of the rectus muscles, diastasis recti. That's not going to get fixed with any kind of intense exercise or diet. You will benefit from the repair of the separation of those muscles through the drainless tummy tuck that I do. Absolutely. So we'll be happy to take care of you. Wow. 3 in 1 go. Whew. More power to you. Cost of arm lipo, please. Caramel Diva. Call my office. My patient coordinator will be able to give you the estimates. I don't have that pricing with me. The only one I know is the drainless tummy tuck because that's my signature procedure, and it's usually around $13,000 to $14,000. But it could be as low as $11,500. It all depends on the patient, their past medical history, their surgical history, how many scars they have, if they have hernias and things like that. So all of that varies. Comes into the variation of the pricing, but you can definitely call us and we will give you an estimate once Linda gets a little bit more information about what you get done. Okay, what you need to get done. TT 45 450. Do you do hernia repair? So for virtual hernias, I'll have you get your repair done by a general surgeon. So you would have to get that fixed. Now, if I if I do the drainless tummy tuck, we don't know that you have a hernia, and I see that you have a hernia. It's happened before. I will fix it while I'm doing the tummy tuck. It does prolong the surgery, makes it longer because there's a lot more work that needs to be done. Thank you very much, Barack, for the roses there. I appreciate that. Oh, we're at 80% of our goal. A couple more roses and then we'll meet our goal. Come on, guys, we can do it. But if I see it while I'm doing the tummy tuck, I will go ahead and fix it. Yeah, but if there's a known hernia before, typically you'll get it fixed before you come in to see us. Boar Bear 8. Lipo 360 and breast lift and tummy. Do you do it at the same time? Yes. I do that on my patients quite often. And that would be one type of mommy makeover that my patients will want to have done. So that in particular for you will be your mommy makeover. So definitely contact us and we'll be happy to do that for you. In some patients, I actually do all of those procedures that you asked, as well as fat transfer, so like a BBL or even fat transfer to the breasts. Dia, is it possible to do a tummy tuck and a BBL together? Yes, it is. Absolutely. And I do that quite often on my patients. That's kind of like the standard tummy tuck. I mean, sorry, not tummy tuck. Standard mommy makeover package that patients will have. Others will combine that with breast surgery, either a breast lift, breast augmentation with implants, or breast augmentation with fat transfer, or even a combination of breast lift and augmentation. So it all depends on what you want to have done. Yeah, we can tailor tack everything and make it specific to you. Barack, you okay? Do you have a recovery stay place for out of towners? So we have recommendations. If you'd like to stay in a recovery home, absolutely. But like I was telling my patient, like I tell all of my patients, sorry, I have to let TikTok know that we are still live and doing well. They want me to verify. Um, oh, hi, my Cynthia Spa. Nice to see you guys. Hope all is well. So definitely, the way I do my procedures is to make your recovery a lot easier and smoother. You do not need skilled nursing facilities. You do not need a recovery home to be able to recover. Most patients will come in with an adult who will be their caregiver. We require at least the first 24 hours after your surgery to be with an adult. Now, so my patients will stay usually with friends or family if they have them here in Houston, or they'll stay at an Airbnb or a hotel. Or if you really want to stay at a recovery home, we definitely have some recommendations. Absolutely. And we will discuss that in greater detail during your consultation and your preparation for the logistics for you to have your surgery. Oh, wonderful, wonderful. You're very welcome, TT Long Number. I'll be happy to take care of you. Okay. All right, Lachey Turner Fluker. I'm 57. I would love to have a tummy tuck. What will my recovery time be? Okay, so for the drainless tummy tuck, I've done it on patients in their 50s, 60s, and even in their 70s, and they've all recovered fairly quickly. Most patients will wean off the pain meds usually within 3 to 5 days. They're typically walking upright within 3 days after the surgery. The technique that I do is to make your recovery, like I said, faster and smoother. There's quite a few patients of mine that follow us regularly on TikTok who share their testimonials. I believe we have Jackie Marie who's here. Sometimes Luana Wilson will come in. I also have 7709 who is in the Austin area. She's had her tummy tuck. She's in her 70s, and they've done extremely well and have recovered well. It all depends on how healthy you are. It's not your age that is really the determining factor. But you can anticipate, like I said, taking off 1 or 2 weeks from work. Most patients usually will be at work within the second week, depending on what you do exactly. But it should be fairly quick, and you'll be very happy with the results. So browse through the content on TikTok. You'll see a lot of testimonials, patients' visits. Within the first week after surgery, they'll be giving their testimonial. You'll also see some before and after pictures of the results as well. So contact us, put in your information in the bottom left of the screen there, and we will be happy to take care of you guys. All right. Hey, how are you doing, Brandy Lou XO? Thank you so much. Hi, it's so nice to see you. You bounced from Instagram to my TikTok. Good, I appreciate it. I hope you're doing well. I miss you. Come by and see us sometime, okay? And wish you well. God bless you. And like I said, I hope all is well with you and your family. BMI, Barack Hughes is asking about the BMI. So the max BMI for these procedures is 35. So like I was telling everybody, if you're 5'4", the maximum weight will be 204 pounds. If you're 5'8", it'll be 228 pounds. So definitely we want you to be less than that BMI of 35 to be able to get you in that safer zone. Okay, so 7 is asking, if I have a hernia, can I get a liposuction? I would highly um, uh, uh, discourage you from having liposuction if you have a hernia. You have to get that hernia fixed first. The reason being is a hernia means that there's a defect between the layers that separate your skin, fat, muscle, and then that separate the deep organs. So if you've got bowel poking through that hernia into that space where we do the liposuction, remember, we do liposuction in the subcutaneous space, which is what I described earlier. The cannula goes all over that space. And if you have bowel that's poking through a hernia and inadvertently the cannula goes through it, it's very dangerous because you can get septic and you can die. So we definitely want to avoid that. So we want you to get your hernia fixed first and then get your liposuction, or avoid liposuction anywhere around that hernia at all. Okay? Great questions. Okay, so Lachey Turner, Fluker, I think I answered your question. How long is the tummy tuck recovery? Like I said, it's most patients 3 to 5 days. They're walking uprights off their pain meds, come back to see me within a week, walking uprights, feeling comfortable, usually driving themselves in, and then able to go back to work after that. Nicole Lafleur. How would skin removal work if I have scar across my stomach from birth? Like 360 body lift. Okay, so it all depends on where your scars are. I've operated on patients who have multiple scars, not necessarily from birth, but from other surgeries. They've had appendectomies, they've had their appendix removed, they've had C-sections, they've had emergency C-sections where the scar goes straight. They've had previous abdominal surgery where they have the scar that goes from the top of the belly, so the rib cage all the way down to the mons pubis. They've had tons of other procedures on the belly. So it all depends on where your scars are. I'd have to examine you and see what needs to be done and how we can improve it. But all my patients have done well and have been very pleased with the results. Okay. I think we've answered pretty much everybody's questions. Let me see. Okay, a couple more questions here. We're going to be wrapping this up shortly. You're very welcome, Baraku. Thank you for your participation and for asking your questions. We'll be happy to take care of you. Let's see here. Oh, great. We reached our goal of 50 roses. Thank you so much, everybody. I appreciate that. Nydia Ponce is saying, would you do a 360 tummy tuck and a fleur-de-lis at the same time? Yes, I've done that. So if you go through my content on TikTok, you'll see some before and after pictures and some videos of these patients and the results. So it's a body lift. So it's a combination of a hip lift, butt lift with skin excision, and a drainless tummy tuck. However, for you, it would be a drainless fleur-de-lis tummy tuck. Yes. So I'll do all of that at the same time. Absolutely. To give you the best results. So come and see us and we'll be happy to take care of you, Nydia, okay? Putting your information in the bottom left of the screen there. Let's see here. Okay, so Nicole Lafleur is saying, if I want skin removal surgery at the beginning of summer, when should I start having my consultation? Come in now. We're already coming into April. A lot of people are already booking their surgeries for summer. So definitely come in now. Our quotes are good for 6 months. So if you come in now, it's like April. It's good through summertime going into fall. So you'll be good. You'll be able to, quote-wise, you'll be good. But most of all is having the time off and getting the specific dates booked. You want to book them now because I share the operating room with 4 other plastic surgeons, and so everybody, has scheduling. So we have to make sure that if you know specifically kind of like which part of the summertime, you said early summer, which dates, which weeks work, definitely come in for your consult, or we can start virtually, and we will book the date for you so that we are guaranteed to have that spot for you. Great questions, everybody. Thank you, Jackie Marie. I thank you very much for participating. This is one of my, like I said, a patient who's gone through. She was on TikTok. She found me on TikTok. She's been participating, following, asking all questions. She's finally coming for her surgeries. She's done extremely well. She's several months out. And thank you very much for your comment. You won't regret it. I've been wanting it for many years. Where was he then? Great. I'm very happy that you found me, that you found us, and we were able to take care of you. All right. Congratulations. Yes. Perfect. Okay. Well, have a good evening, everybody. Jackie Marie, if you're at work, may you have a wonderful shift. Hello to your husband. And all right, last question here. Let's talk about it. What are the signs of a hernia? I've been told I have one. Signs of a hernia. So you could have, if they're severe, you could have some blood in your stools, some stomach aches. You can also see, for example, it could be diarrhea, blood in your stools, stomach aches. Whenever you eat, you may have some bloating. You can see some protrusion in your belly area, or when you feel your belly, you can feel like there's a defect, a hole, or something comes out and goes back in. So that's where the hernia would be. Not everybody has those signs. They may have a hernia without actually feeling anything or having any symptoms, or even say, for example, your belly button. Your belly button could be like protruding and pushing out. That's a sign of a hernia. You may not have any pain or discomfort, but those are kind of like different signs of that. Okay, so wonderful. You're very welcome. Thank you very much, everybody. Definitely. Thank you very much, Jackie Marie. I appreciate the support there. She's saying y'all call and get on the book so we can take care of you guys. So, you work days now. Oh, home health. Oh, I am so happy for you. Congratulations. Night schedule is tough. I've been through it as a physician. It's tough. So I'm so happy you're working days now. Enjoy it. And hi to your husband. Looking forward to taking care of you next time when you come in for your next procedures. Everybody, thank you very much. Have a wonderful evening. I got to get ready for my surgery tomorrow. We're going to be doing a mommy makeover. It's going to be a lipo combination. You guys have asked combination of lipo 360, drainage tummy tuck, and BBL. Fat transfer. It's going to be a wonderful transformation for my patients. So stay tuned. I'll talk about it more tomorrow. We'll be taking some video footage as well, and then putting a photo and video montage to hopefully be able to share it later on TikTok. God bless you, everybody. Take care and have a wonderful night. Okay? Yay. Excellent. Thank you very much, everybody. Take care. Bye-bye. I do this live every Tuesday and Thursday, time permitting. So catch us on the next one, okay? Bye-bye. Thank you, everybody, for participating on the live Q&A session here tonight. I appreciate it. I do this every Tuesday and Thursday, time permitting. Usually I start around 7 p.m. Central Standard Time and kind of go usually till about 8. Sometimes I go a little bit over, depending on how many questions I get. So contact us, DM us, and we'll be happy to take care of you guys and get you the body that you want, okay? Bye-bye. Thank you, everybody, for tuning in and participating on YouTube. I appreciate the like there. Until next time.